Now from CBS 2 News, this is a special report.
Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's listen in.
In weeks or so, and it feels like such a long period of time, but think back to March, where every day brought new shocking developments, things we had never seen before. A lot of times we were just fighting to keep going as we dealt with more and more challenges. And now, thank God, in recent days, we've had much better news. We're still not out of the woods, but much better news, much bigger progress. And now, as I talked about a few days ago, the whole idea is to get on the offensive against this disease, fight it back, marshal our forces to make sure that we get to the day where we rid New York City of this challenge once and for all. When I think about that sense of being on the offensive, being on the march, I think about, first of all, what all of you have done, because that's the essence of why we've seen this amazing progress. I also think about the fact that as we fight back this disease, we're going to fight back the many, many challenges it has laid bare, most especially the disparities we see in communities around this city, the healthcare disparities in particular that have been so striking and painful in this crisis. We were all doing everything we could in the first weeks just to make sure that we could save as many lives as possible. Now we're going to not only save lives, we're going to fight these disparities in so many ways going forward. So we talked about what it took to save lives, to protect people, particularly in the areas hardest hit. Our public health care system, our public hospitals and clinics were really the core of that, particularly in the first weeks of this crisis. That's where so many people turned for help, and they did an extraordinary job. To all the folks who work at H&H, all the folks who work in our public hospitals and clinics, they were absolutely outstanding during this crisis. And that was, in many ways, the first place we had to focus. Now we are focusing more and more on all the other ways we can reach communities that have been hit the hardest and need the most help. And one of the most important elements of that is supporting community-based healthcare providers. Now, community clinics, think about what they mean to so many people. There's a place that people turn for health care who don't have other options. They're a place for a lot of folks who don't have a lot of resources, aren't sure where else to turn, don't have a long-term relationship with a private doctor. The community clinics are the place they can depend on. Literally, the community clinics know the people of their neighborhoods. They speak the language of the people in their neighborhoods. They do amazing work. And they've had to do a lot during this crisis, but with many, many challenges that have been a real hindrance to the good work they do in normal times. Remember, these are smaller community-based practices. So their financial situation has really been put through so much. There's been a lot of strain during this crisis. It's been hard to keep the personnel they needed as they've dealt with so many new challenges. They have always a need for more technology to deal with an ever-growing demand. Our job now is to fortify these community-based healthcare providers, because as we go on the offensive, as we go right at these disparities with the goal of helping more and more New Yorkers through this crisis and beyond, these clinics become a crucial part of the solution. So I talked to you a few weeks ago about a 4-point plan to address disparities right after we showed that the facts bore out how deeply the disparities played out in this crisis. We said there's a number of things we're going to do differently in this city. I laid out 4 different parts. I want to dwell on the third part of it today, which is the grassroots reach of these community-based healthcare providers. So we're going to be working with over 1,000 community-based providers in 26 of the hardest hit neighborhoods in this city. What are we going to do? Well, first of all, a lot of them need the personal protective equipment, so we're going to make sure it's there for them. Some of them literally couldn't do their work even couldn't keep their clinics open for the lack of it. We're going to get them the PPEs they need for the work in the clinics, for the ability to go out into communities. This is crucial to protecting the good folks who work in these clinics, but also allowing them to do their work and reach more people. We will be distributing 120,000 surgical masks per week, 115,000 pairs of gloves per week to begin, and we'll keep building from there to make sure these clinics have what they need. Of course, like so many other parts of our healthcare system, these clinics were often shorthanded during this crisis. They had to deal with those that they lost who were sick, and they had to deal with the fact that they had immense financial strain and couldn't afford to keep people on their payroll. We are now addressing that head-on with members of our Medical Reserve Corps, doctors, nurses, other healthcare professionals. We're going to add hundreds of these professionals, these clinicians, to the clinics in the coming weeks and provide them with the personnel resources and cover the costs so that they can get back up and running as fully as possible. Telemedicine, we've talked about this before. This is a crucial piece of the equation. When it comes to the clinics, telemedicine is also important, not just what we're trying to do with our public hospitals and clinics, health and hospitals, not just what we're trying to do with phone a clinician. We talked about that a few days ago, but the telemedicine that can be done with a community-based clinic. They know their patients, they know the people they have long-term relationships with, but they're not historically using telemedicine as a crucial tool. We're going to help them now do that more and more. And the wellness checks are a big part of it, reaching out regularly to the patients from the clinic to just check in on them, see if they need anything, constantly proactively communicating. So last month and continuing this month, Department of Health is running weekly telemedicine webinars to help these community-based clinics get used to how to maximize their use of telemedicine. And our goal is to train 150 of these clinics to be particularly proficient in telemedicine, to help them make it a very common part of what they do, and then we'll expand from there. We also want to see these clinics play a crucial role in our test and trace initiative. This testing and tracing is the thing that you're going to see grow and grow in the coming weeks. It's absolutely crucial to how we move past this phase of this disease and move forward. These community-based clinics can play a crucial role. We're surveying all of them this week. By next week, we're going to know what each one can contribute to the test and trace effort, and we're going to bring them into it deeply. And then one more point on federal aid. A lot of these community-based clinics are crucial not just to fighting this disease, but to the future of the neighborhoods they serve and keeping them healthy against so many other healthcare challenges as well. But they're going to need resources to keep going. There are literally billions of dollars available from the federal government through initiatives like the Paycheck Protection Program. These clinics qualify, but we have to make sure they get their fair share. Our Small Business Services Department is going to reach out to each of them and help them in the application process to maximize the federal aid going to them. Now, the focus will be on the places hardest hit by the coronavirus in this city. So we're going to be focused on neighborhoods all over the 5 boroughs. In Brooklyn, those neighborhoods will be Flatbush and East Flatbush, Brownsville, Brighton Beach, Flatlands, and Canarsie, East New York and Starrett City, Sunset Park, Bushwick, and Bed-Stuy. In the Bronx, Crotona and Tremont, Highbridge, Mott Haven, and Morrisania, Bronx Park, Van Cortlandt Park, and Fordham, Northeast Bronx, Pelham and Throgs Neck, Kingsbridge and Riverdale, Soundview, and Longwood and Hunts Point. In Manhattan, Morningside Heights, Inwood, Washington Heights, and Hamilton Heights, East and Central Harlem, and the Lower East Side and Chinatown. In Queens, Corona, East, Elmhurst, and Elmhurst, Briarwood, Jamaica, Rockaway and Far Rockaway, and Queensbridge. And in Staten Island, Stapleton and St. George, and Willowbrook. So the goal will be to right now maximize the use of these community-based facilities, the providers, the clinics that have such a big impact on their communities. Help them right now to be in the forefront of our efforts to fight back the coronavirus. Get them right now more deeply into things like telemedicine and the test and trace initiative, and leave them in stronger shape for the future as well. Serving the communities that have been hardest hit during this crisis, the low-income communities, the immigrant communities, the communities of color that have really taken it on the chin during this crisis. We want to strengthen these community-based providers now and for the future. Now, we think about our neighborhoods. We think about what it's going to take for our neighborhoods to come back. And we are a city of neighborhoods, so thinking from the grassroots up is the right way to do things. When we think about our neighborhoods and what makes our neighborhoods strong, we think about small business. We think about small business in every way. Part of what makes our lives so good in this city is the small businesses that we depend on, that are part of the character and identity and the culture of our neighborhoods. Of course, they're also huge employers. When you add up all the small businesses of New York City, the mom and pop stores and all the kinds of small businesses, that's where so many New Yorkers get their livelihood, and small business has gone through so much during this crisis. Small business makes New York, New York. When you really think about so much of what we emotionally identify with, so much about what we care about our city, it comes back to our small businesses. So we're going to have to do a lot to help them back. Many are going to struggle coming back. We've got to save as many as possible, help as many as possible on the road back. On Friday, I had a call with a group of small business owners. In this case, smaller bars and restaurants. They're a group called the New York Hospitality Coalition. And they wanted to help me understand what they were going through and what they needed to come back. And what was so clear on this call was these are folks, like every small business owner, they put their heart and soul into building up their business. It was something that was really a part of their identity. It was they put themselves into it, and they would do anything to keep their small business going. And they had a deep sense of being there for the people who are their customers, who are the people in their neighborhood that depend on that small business. They, each and every one of them, wanted to come back, not just because it was their livelihood and what they had created, not just because they cared about the people who worked at their small business, but because they knew their neighborhoods depended on them. So hearing their voices, and I'm going to be talking to many, many other people in the small business community going forward, reminds me of everything we're going to have to do. At the beginning of this crisis, we did what the city could do with a $50 million loan and grant program. Obviously, a huge, huge federal program, hundreds of billions of dollars has come into play since then, although there are many challenges with small businesses accessing it, and we're still fighting to help them get that done. But we are going to need much more to help small business going forward. And we're going to have to find new sources of support for small business. To say the least, this is not going to be business as usual. We are going to have to find ways to help small business that are different than anything we've ever done in the history of New York City. We've got to maximize, of course, the federal aid to small business and state aid to small business, but we're going to have to do some things differently to find a whole new type of support for small businesses to help them back on their feet and help them stay on their feet going forward. So I have two personnel announcements today that are related to the new approach we're going to take to small business in this unprecedented time. First of all, I am creating a new position as Senior Advisor for Small Business related to the COVID-19 crisis. And I'm naming to this position Greg Bishop. Greg has served as our Commissioner of Small Business Services since 2015. He's done a great job, and he has been the voice of small business owners all throughout the city government. I've talked to so many small business owners who appreciate deeply what Greg does. He understands the small businesses of the city. He's going to bring that expertise to bear to help us develop a whole new approach to bringing resources and support to those small businesses. He'll work closely with our public-private partnership czar, Peter Hatch, who's been doing a fantastic job bringing in philanthropic support and support from the business community locally, nationally, internationally for New York City. Now we need a lot of that support to be focused on how to uplift small business and provide the resources for small businesses to get back on their feet, and the ability for small businesses to have new customers, new revenue to keep them going in this new reality. I'll charge Greg with finding whole new sources of capital for small business. I know from having spoken with people in the philanthropic world that they understand that unless New York City small businesses come back, our neighborhoods can't come back the way we need them to. I think there's going to be a tremendous sense of generosity from the world of philanthropic organizations, many of whom have a deep focus on New York City already. Greg is going to be charged with tapping into that desire to help and building a whole new initiative to bring in those resources, but also to deepen the connection between larger businesses and small business. When I had a call last week as well with the heads of some of the largest businesses in New York City, and to their credit, they said they understood small business was hurting a lot more than larger business, and small business would be crucial to any restart and recovery. And they were already asking themselves, what could larger businesses do to patronize smaller businesses, to work with them, to provide them capital, to do things that larger businesses hadn't done so much before systematically with small business, but needed to do now for the good of New York City. It was a very heartening conversation. Greg Bishop is who I'm going to turn to take that idea and make it a reality and really catalyze that instinct we're seeing in the larger business community and bring it to bear to help small business. Now, and given the important work that's happening, the everyday work of small business services, we needed a new leader to come in to be the commissioner following Greg, to pick up the work that he's done and deepen it in the next 20 months ahead in this administration, because small business services every day is solving problems for small businesses, figuring out new ways to help small businesses. Even in normal times, that reality is going to be more and more complex now. But our Department of Small Business Services has proven itself time and again. It's going to take on more and more responsibility going forward. To fill the role of commissioner, I've chosen Janelle Doris. Janelle has done an outstanding job as our director for the Office of Minority and Women-Owned Business Enterprises. He's led a really systematic, energetic effort to expand MWBE contracts coming from the city. $14.6 billion awarded since 2015, $1 billion ahead of pace for our 2020 goal. A lot of that has been because of Janelle's energetic leadership. So as the new Commissioner for Small Business Services, I'm going to ask him to look at every way that that agency can help small businesses in this recovery. All the ways that we have to simplify what small businesses go through in their dealings with city government. Here's a moment of crisis, but it's also a moment to rethink what we do with and for small business and how we can lighten the burden on small business. Janelle's someone who's proven himself to be an innovator. I'm going to ask him to look at the situation from scratch and figure out how SBS, in its own work, but also as a leader for the small business community in the whole city government, can get all city agencies engaged in the work of helping our small businesses back. Look, we know small businesses of every kind are hurting. I've heard particularly concern from immigrant communities and from communities of color about whether their small businesses will be able to come back in this environment. In many cases, small businesses that had the most tenuous financial situation even before the coronavirus. We've got to help each and every small business come back. I know it'll be a huge challenge, but I want small businesses all over the city to know the city government is here for them, and we're going to find new resources and new ways to help, and that we can weather this storm together. So with Greg's leadership, with Janelle's leadership, I'm confident we'll be able to do a host of new things to help small businesses to get through and then become strong again as we move back to normal. Now, we've talked about some of the challenges that have been so profound in this crisis. We've talked about what some of the hardest hit communities have gone through. We've talked about what our small businesses have gone through. Clearly, when you think about who's challenged every day in New York City, our hearts always go to homeless New Yorkers. And in this city, we feel a lot for the fact that some people ended up living on the streets. Something happened in their life that led them to that point. Our job is to help them back and to create a better reality for homeless people. So I have two updates today. And the first relates to our shelters. We've been trying to make sure, as we deal with the coronavirus, that we're constantly evaluating our shelter system and moving people as needed to make sure everyone is safe and healthy. I told you we were going to have a goal of moving 1,000 people per week out of shelters into hotel settings to keep opening up the shelters, to keep making sure we could do proper social distancing. We met that goal last week. We will be meeting it again this week. There's now over 8,000 single adults in hotel rooms. And we'll keep doing that as needed in the weeks ahead, and particularly as we build up our widespread test and trace initiative, which is going to help everyone, and that initiative will also be focused on our homeless shelters. Now, the second update I want to give, and this is something we've been talking about over the last few days, is what's happening with homeless folks who have been in the subways. And I keep telling you something historic is happening, and day after day, the facts bear it out. The new initiative that we put together with the MTA and the state, 6 days now, and 6 days that have been entirely consistent. Something really groundbreaking is happening here, something very different and very powerful. Last night, when the subway shut down for cleaning, our homeless outreach workers and specially trained members of NYPD were out there to help homeless New Yorkers, to offer them a chance to come in and get support. 261 homeless individuals were engaged. 139 of them accepted help. 116 went to shelter, 23 went to hospitals. Again, numbers we've never seen ever in the history of the city. Such an extraordinary number of people agreeing to take help, agreeing to take the first step towards a very different life. It's early, to say the least, just 6 days, but they've been very, very consistent. And when I look at the sheer number of people whose lives now could be changed, it really gives me hope that we're going to be able to get a number of homeless people once and for all off the streets into a better life. So another good day for this new initiative. Now let me turn to something that's an everyday thing in this city, something we all think about, or many at least think about, and always want clear answers on, and this alternate side parking, part of everyday life for so many New Yorkers. So alternate side parking, we've been suspending it quite a bit, obviously given everything people are going through and wanting to make it easier for people to stay home. We said throughout we got to keep an eye on how our neighborhoods are looking. Are they clean? We want to keep them sanitary. We want to make sure that while we're trying to give every consideration to people, we also have to keep an eye on cleanliness, very important to the overall health and well-being of the city. So we've suspended alternate side many, many times in the last 10 weeks. But now we do see a number of areas in the city where some litter is starting to add up, and we're concerned. So we're going to do something a little different this coming week, and then that will help us reset for the future. So alternate side will continue to be suspended this week through Sunday, through May 17th. And by the way, this suspension now that's happened over recent weeks is actually one of the longest in the history of New York City. So this suspension has helped people, made lives a little easier, helped people stay inside. We'll keep it going through Sunday, May 17th. Starting on Monday, May 18th, we're going to do a clean sweep all over the city, a catch-up to make sure neighborhoods are clean. So alternate side parking will resume on Monday, May 18th, and go through the end of that week. So again, 1 week, the week of Monday, May 18th, alternate side parking will resume just for that week. We will then suspend for the following 2 weeks. So it'll be suspended again through Sunday, June 7th. So the goal here is if we do that 1 week cleanup, hopefully that will last us a substantial period of time. But again, we have to see how it goes. We have to see what we can achieve, make sure neighborhoods are clean. So again, everyone, this week, no alternate side. Next week, back on for 1 week only, and then suspended again for 2 weeks after that. Okay, I want to talk about an incident that happened last night. And this is something that we've seen in the context of this whole painful crisis. Remember, there were too many times, way too many times, over the last 10 weeks when I've had to talk to you about incidents of bias directed at Asian Americans in the context of the coronavirus crisis. We don't accept bias in New York City. We don't accept hate in any form. Any act of bias, any hate crime, we pursue it. We make sure there are consequences for the perpetrator. That's something that people have seen time and time again in this city, that we take it seriously. All of us take it seriously. We take it seriously here in the city government, and the NYPD takes it seriously. So we saw those horrible incidents directed at Asian communities. Now, last night, a different incident in South Williamsburg. Two perpetrators, one male, one female, ripped masks off members of the Jewish community who were walking down the street. This is obviously absolutely unacceptable in every way. It's something that expresses hate, but also creates danger. And that's unacceptable, and we're not going to allow it here in this city. The two perpetrators have been arrested by the NYPD, and we are treating this incident as a hate crime. So there are serious consequences when someone commits one of these acts. So look, whether it is this horrible anti-Semitic act that we saw or the horrible anti-Asian acts we saw in previous weeks, none of these acts of bias and discrimination are acceptable in New York City. And the fact that the perpetrators were arrested immediately is a reminder to everyone out there. We will not tolerate hate. We will act on it quickly. Anyone who engages in an act of hate will be suffering the consequences of their action. Okay, every day we come back to our daily indicators. And this is what we look at every single day to see how we're doing in this city and where we're going. Today, I have good news, and this is really wonderful to report to you because it gets back to what you've been doing. Every time I get to give you good news, it's just a reflection on all of you, because New Yorkers are taking shelter in place so seriously, social distancing so seriously, face covering so seriously, and it's making a difference. So the indicators today show at first the daily number of people admitted to hospitals for suspected COVID-19. That is down from 69 to 55. And boy, look at that, two things to see here. One, down, and down substantially. That's great to begin with. But down to just 55. We are not out of the woods, but when you see that number go down as low as 55, that sure is heartening compared to where we were. And a credit to all of you. Daily number of people in ICUs across our public hospitals for suspected COVID-19. It's down. It's only a little, from 540 to 537, but it's still down. And that is progress. And the percentage of people tested positive for COVID-19 citywide down from 17% to 13%. So this is exactly the kind of day we want to see. Now let's see if we can stretch a number of these days together. And that'll be the signal that it's time to start talking about relaxing some of these restrictions. But first, we have real work to do to get there. A few words in Spanish.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak in New York City. We're now returning to regular programming on CBS 2. For extended local news coverage, you can stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News. We now return to our regular programming.